1500-hour UTC. We're 3 minutes ahead here. So far, we've had early check-ins. Myself, PE7PSP, PY2BBQ, N9OML, N3IM, WA1EXA, W2JLD, N5RTF. Are there any other early check-ins? Go ahead and make a call.
Kilo Charlie 6, Uniform Quebec Tango.
Okay, no additional check-ins heard. We'll be here at the top of the hour momentarily and formally start the net. The net meets every week. The Medical Image Radio Council, composed of members all over the world who are involved in the healing arts or have an interest in the healing arts. So a lot of physicians, dentists, pharmacists, etc., nurses. But we're not limited to individuals that are working. There's many of us that are in research. There's many of us that are retired. And there are also general members from the community that are interested in medicine. So everyone's invited to participate. Let me let it drop one. When we continue check-ins momentarily, if you are not a member of ARCO and you'd like to participate, please do. If you want to participate through listening, that's fine. Please do that. It would be preferred that you would let us know that you're here monitoring, and just let us know that you want to monitor only. And we're here at the top of the hour. Hilton has started the YouTube recording as well. So on the MarcoAudio.net, we have a live recording here. We have a recording being made by N5RTF in New Orleans. And we have a YouTube recording in real time here by PY2BBQ. He's posted again a link to NetLogger. And you'll be able to not only hear the audio, but you'll be able to see the instant message screen as well as the NetLogger screen logged in. At this time now, for the net, we're going to go ahead and disclose a few housekeeping items. So your station's check-in is directed net, so we're through AA4L. Make sure you wait about 2 seconds before transmissions. We're on the quad-head array, and we do have connected repeaters and connected equipment all over the country that need to sync. So that's the reason for the pause. Don't tailgate the next person. Let me let it drop one. As previously mentioned, we have NetLogger up and running. You can look for the Marco DV Net QuadNet array is the description. See who's checked in, but just as important is the instant messenger feature, so we can have you ask questions, etc. And with that, we're going to go ahead now and ask if there are any stations with emergency or priority traffic for the net. Please call net control now. None heard. Are there any mobile stations or other stations that won't be able to participate in that that have important comments or announcements? Please call now. This is AA4FL Net Control for the Marco DV Net, and I previously read off a list of the 8 people that have already checked in. Are there any additional check-ins at this time? Go ahead and make your call. J3FZT. Morning, Jay. Good morning to the man. Good morning, Stephen. K3FZT. AA4FL. Any other check-ins? Go ahead and make your call.
Kilo Charlie 6 Uniform Quebec Tango.
Good early morning to you, Craig. KC6UQT. Thank you for joining us today. Any other check-ins? Well, thank you for joining us this morning. We'll have time for check-ins later. We have a few check-ins from the West Coast. We have check-ins here from the middle of the country, both from Illinois and down in New Orleans, getting ready for the hurricane. We also have Brazilian station checked in, and some in the northeastern United States. So we have a good representation of members. We were hoping VU3WTJ would be with us from India. Mr. Sandhu often is, and perhaps he'll still check in. Of course, the time differential in India is not in favor of convenient times to participate in the nest. This is AA4FL Vent Control today operating from Delray Beach, Florida. And rather than focus on what's happening here in Delray Beach right now in the state of Florida, I'm going to go ahead and go down the list here and let you all have a chance to tell us what's happening in your area in medicine, mostly COVID and otherwise. So we have first person that was with us today is Richard, the PE7BSP. Go ahead, Rich.
Good morning. This is Victor Echo 7 Bravo Sierra Papa. It's good to be back on the net this morning, and Jay, I apologize. I'm having some difficulty with modulation on your transmission, so I didn't quite get your question for this morning. Please come again.
Sorry about that on my end. I'll look and see if I can make adjustments in the audio level. But we're looking just to go ahead and make a presentation. Anything you'd like to say about COVID in your area or any other medical situations that are present in British Columbia or Canada and greater? Go ahead, Rich.
Thank you for that, Jay. It's E7BSP. At the present time, here in British Columbia, we are in a phase 3 of 4 of reopening, but we've retrenched a bit because we've had some significant upturn in Delta variant, like we're hearing in the media, in otherwise non-vaccinated or single-dose vaccinated individuals. There is a prevalence in youth. But that being said, the full vaccination rate for the province of British Columbia is north of 70% now, and at least one vaccination is well north of 80%. So we're getting close. At the present time, we're also into a full mask situation in all community gathering locations for the time being, and our final stage of reopening, phase 4, has been suspended for the time being.
Thank you for that report, Richard. What's the current status of travel for Canada? So many of us Americans are interested, of course, in traveling. What are you aware of? AA4FL, the V7BSP.
Great question, VE7BSP. To come into Canada, that is possible from the U.S. For any U.S. citizen. They must be able to show valid, full vaccination documentation to enter Canada. The President of Canada cannot travel to the U.S. because that's obviously President Biden's decision that's been suspended until later in September. Travel within Canada is still open, but airlines, airports, and that all require full masking the entire trip from the time you walk into the airport to the time you walk out of it. There has not been any discussion at this point about changing travel within Canada. And then just this week, the UK has put Canada on the green list that the US has been on for some time for international travel. But I'm not familiar with where other countries are for international travel in and out of Canada.
Thank you very much for the report. As to the rest of you that are checked in here, do you have any particular questions of Richard as it pertains to Canada and travel? Go ahead and let net control know at this time.
WA1EXA.
WA1EXA, go ahead and address VE7BSP directly now, Mark.
Yeah, Rich, can you tell me what the status is of a booster shot or the third shot? Are they talking about it? Are they going to do it up there? Is there any information? Go ahead.
WA1EXA VE7BSP. There is discussion. It is being considered at the federal government level, and I'm hearing rumblings within our provincial governments that are connected with the federal government on this topic. There's been no affirmative decision yet, other than clinically we're all expecting there's going to be a need for one, and the question is which vaccine and at what timing. So right now, we know it's under consideration, but there's nothing in the public domain that we're aware of at the moment.
Okay, thank you. Yeah, we in Massachusetts anyway expect to start with immune compromised people and older people, like in nursing homes, things like that, in September. That's the latest information that we have here. Back to you. Thanks for the information. Back to you, Jay.
AA4FL net control. Good to hear the two members who in the pharmacy field discuss this. I was in the pharmacy yesterday with my father-in-law here in Florida, getting him a booster since he's in medical need for such stuff. There were a lot of individuals there that weren't, that were sort of just filling out the paperwork and checking off being immune compromised, which more than likely they all weren't. Even the younger people, the Facebook manager my daughter tells me about, that's happening here in the States. Well, next on the list here, PY2BBQ, Hilton. Good, well, I guess it's good afternoon for you now, Hilton. Go ahead, AA4FL.
Okay, A4FL, this is PY2BBQ Hilton from São Paulo, Brazil. And yeah, we have some news this week regarding the COVID-19 pandemic. The vaccination goes on and is spreading really quickly here in Brazil and São Paulo state in special. Um, uh, we are vaccinating the adolescents 12 years old and up. We have about here in my city in São Paulo, which is the biggest city in the country with 12 million people. We have 98% of the population that received at least one doses of the vaccine, 98% of the population. And the second dose is going on very quickly too. We expect that in at least 2 months we will have the whole population fully vaccinated against the COVID-19. And the Delta variant is the prevalent right now. It was not at least 2 weeks ago, but now it is the prevalent. And fortunately, we had time to go on with the vaccination before the Delta variant came. So we are not seeing an increase of new cases or an increase of hospitalization or death. In opposition, it keeps decreasing in the same level that it was weeks ago. It's going down, and we are seeing some interesting movements. Wait, well, what I have noticed is that especially in the hospital that I work, which is the Albert Einstein Hospital in São Paulo, the decrease of number of patients with COVID-19 and the increase of non-COVID related patients in the hospital. And that's good news, especially for me. You know, I'm a general surgeon, and the COVID pandemic was really bad for my practice. And I do 100% private practice, and well, I don't see COVID patients. So now it's coming back. It's the movement of general surgeries are increasing, and it's coming back to normal state. Well, we keep on doing social distancing, using of masks, and so on. Well, I'd like to say something about the Brazilian contest that starts today at 21 UTC. It's the CVADX contest, which is the Verde Amarelo contest. It means green and yellow contest, which are the colors of Brazilian flag. And this contest is the older of the in amateur radio in Brazil. It counts more than 60 years, and it's organized by the Brazilian Army. Okay, everybody is welcome. You have you can program the November 1 mic software for this contest. Just look for the CVA DX. This weekend is single side band only. Last weekend we had the CW contest. This weekend will be single side band. Everybody is welcome. And the exchange for non-Brazilian stations here is DX, is the signal report plus DX. Okay, that's the story from Brazil. Back to Net Control A4FL PY2BBQ.
Thank you for the nice report, Hilton. I do have a follow-up question because I believe last week you had mentioned that only about 55% of the cases in Brazil were Delta. So do you expect another wave? Do you expect to have breakthrough infections as assuming that Delta will become the majority and prominent strain there in Brazil? Over.
Okay, A4FL and the group Papa Yankee to Bravo Bravo Payback returning. Yes, I think there is a main difference between what we are seeing here in Brazil and what you saw in the United States and happened in Europe as well. The Delta variant came earlier for you, so you didn't have time to have the population vaccinated before the Delta variant arrived. And this is being different here. Everybody saw an increase of the new cases, hospitalization, and deaths related to the Delta variant. But that happened in a lower level of vaccination of the population. We expect here not to have such a bad reaction regarding the number of deaths, especially and hospitalization, because of the better level of vaccination of the population. Although the vaccines are not specific for the Delta variant, they have proven to be effective in avoiding deaths and most severe cases of COVID-19. But that's a trend. It's a trend that was seen in North America and Europe, but we have not, we didn't see this here in Brazil, at least so far. It was more than a half of the new cases, Delta variant 2 weeks ago. This is probably much more. We don't have the data available, but probably most of the new cases are related to the Delta variant. Well, we expect that perhaps we may have an increase of new cases, or at least a lower drop of the new cases, but we hope it will not translate into increase of mortality and hospitalization. So back to you, JA4FL UY2BBQ.
PY2BBQ AA4FL, thank you for the explanation. We do appreciate you being here with us and recording the YouTube recording as well. NetLogger Steve F3 on K3FCT has posted some links here that you might find interesting as a group. So if you have the access to the instant messenger window of NetLogger, please look for his correspondence there. Do we have any additional check-ins? Because it would appear there's at least one person on NetLogger who's not currently checked in. Any additional check-ins, then make your call at this time.
Whiskey 1 Juliet Oscar Papa, John in North Connecticut.
QSL, John, thank you for being with us. W1JOP, AA4FL, we do appreciate you checking in. Any additional check-ins? Go ahead and make your call at this time. None being said, I'm going to turn the mic over to N9OML Howard. Go ahead, Howard.
Good morning, Jay, and everybody on the net. Not too much really new to add for anybody.
the Chicago metropolitan area, Cook County, and the state have all rolled back and put mask requirements back into place and several other measures. As is the Chicago way, most of the unions up here have expressed their dissatisfaction with that. I can't explain it, it's just the way we are. Otherwise, of interest to me, Murray's Children's Hospital, which is the old Children's Memorial, did report an interesting factoid. In the last month, they went from 29 injury patients, case patients, to 290. Thank you, Howard. I wasn't sure if I lost you or you finished your transmission, but you were expressing a tenfold increase in the number of pediatric patients. I'd be curious to hear as we go down the list if others have been experiencing the same in their geographic areas. Any additional comments, Howard? Go ahead. Okay, Howard, nothing additionally heard, so I'm not sure if it's an issue on my end. Come back to you a little later. Keith, M3IM, good morning. Thank you for joining us. I'll turn the mic over to you, AA4S.
AA4FL in the group, this is M3IM. Well, Pennsylvania seems to be relatively quiescent overall. We only have 1.1% hospital visits due to COVID-like illness in Pennsylvania. In my county, we have no difference in the average daily number of COVID-19 hospitalizations and no difference in the average daily number of COVID-19 patients on ventilators and 0% of hospital emergency visits. And we had a -9 from last week to this week, the number of patients who were positive COVID. Rick, 68% of the state of Pennsylvania has received at least one dose of the vaccine, and 54% has been fully vaccinated. And this appears to be about the average in the United States by the looks of it. What's interesting is we have a population here that will not get vaccinated for anything. They account for approximately 82,000 people. That's the Amish. And the Amish do not get vaccinated for anything. So we have that population in our county, which is relatively high, probably 4,000 or 5,000 Amish in our county. And so we have a possible reservoir there for almost any disease. This is M3IM back to AA4FL and the DVNet.
Thank you, Keith. Thank you for the description explaining the localized area of Europe and Pennsylvania. Of course, later we'll hear from Steve about the Philadelphia area specifically. But it's nice to hear your perspective, and it's been very upbeat compared to many other areas of the country through this expression of Delta, which we're glad to hear from you. WA1EXA, Mark, go ahead.
WA1EXA. Back. Anyway, I'm trying to read and talk at the same time here. Let's see. Our rate in Massachusetts, as of the last 2 weeks, we're looking at cases are still on an increase, slightly increased, about 1,400 cases. Hospitalization, it's a slight increase, 493 active hospitalized. Our death rate is flat at 6. The hotspots are now isolated to Nantucket and Martha's Vineyard for some reason. I don't know why. I still don't have an understanding about that. Provincetown does not seem to be an issue. Our everything is starting to remask up here on a mandatory basis. Each school district is deciding whether or not to use masks, but I would say the majority, vast majority, is going to be mandate masks for kids and teachers. Break one. And all of the public gatherings, whether they're governmental or private, must be masked. Whether you're vaccinated or not, it doesn't make any difference. We are getting a lot of pushback in some areas, but the owners of the facilities or the restaurants are being adamant that they rather not have people coming in if they're not protecting their staff and the rest of the customers. So it seems to be a pretty solid group of people enforcing this. Our vaccination rate overall 66%, at least one dose is 75%. The highest group being 65 and over, and they're 88% vaccinated. And that's about it as far as this is concerned. We pass along our good lucks and prayers to down in New Orleans because last week we were in the same boat and we lucked out. It became it moved away from us and did not really amount to much for us, although we expected a direct hit, but we lucked out. So unless someone's got some questions, that's probably about it. Back to net WA when the XI.
Thank you, Mark. And we'll continue a little bit of that when we talk to Chuck momentarily about the hurricane situation. I do have a question for both of you that can be handled at the same time. W2JLD, would you like to be part of the discussion? Go ahead, John. Okay, nothing heard right now from John. Chip, before I ask you the question, are you copying us right now? Go ahead.
Here we go again. The Delta variant has definitely has us in its grip. They're really wanting people to get not only the booster shot, but just to get the shots, period. I think we let our guard down too quickly. I have no doubt in my mind whatsoever, that this time next year we will still be fighting this evil COVID virus. And hopefully by that time something will have give us some light at the end of the tunnel. So thank you so much for taking my check-in. This is W2JLD here in Rochester, New York.
Okay, thank you, John. I'm glad you came back to us. So we're going to, in just a moment here, check N5RTF. We'll get to Mike. I'm not sure if we doubled there with Jeff on this last transmission. But we're glad to have you with us, John. We talk about next year. We've got a de-expedition plan to St. Martin, St. Martin, and St. Bart's, which involves 3 entities, 2 French, 1 Dutch, 2 sharing an island, and 1 involving a ferry. We have that plan for May, and we're in the process of discussion as to whether or not we should put that off. We're kind of just waiting until January to see what happens with boosters. But none of us are buying our plane tickets yet. Jeff, in follow up to Mark and to let you have the mic, one area of interest with hurricanes and evacuation centers is the high concentration of people and the problems with potential COVID spread. So as you address your comments, Jeff, then 5RTF, if you could also include that, Elaine.
AA4FL in the group and 5RTF. Anybody that's running an evacuation shelter now is pretty much requiring masks 100% of the time. They also have COVID testing when you walk in the door, and they have a quarantine area for people who are known to be infected, who are waiting out their quarantine period, so that they can be separated from the general population. We'll see in retrospect how well that it works, but this is one case in which just staying at home and waiting out the hurricane may actually be safer than going to a shelter. One other comment in regard to Keith's information about the Amish. I've actually been up there and to Lancaster, Pennsylvania, and seen the Amish communities. I think it's an excellent opportunity for somebody to do some research on the natural course of the disease and the possibility of herd immunity. In 5RTF.
Thank you. Follow-up comment, N3IM, WA1EXA. Keith, do you have any comments to make in that regard to Jeff? Go ahead.
WA1EXA, make sure I'm not doubling.
Yeah, that would be an excellent study. The Amish population in Pennsylvania has demographically changed somewhat in that a lot of the Amish sold their farms in Lancaster for mega dollars because of the construction of homes and parks down there, and have moved into the more rural areas where they can farm and have their schools and their stores. But however, if Pennsylvania were to do a study on the herd immunity among the Amish, it may be a valuable tool. And of course, they may have information about other diseases because the Amish don't get vaccinated against polio or measles, mumps, rubella, or any other disease. So that would be a good study to look at for herd immunity for COVID. AA4FL, the DBNet, this is N3AM. Back to you guys.
AA4FL, and the group, this is K3XT in Philadelphia. Pennsylvania as a whole kicked over into high level of community infection. Perhaps not Clinton County so much, but certainly Philadelphia, Pittsburgh, Lancaster, Erie, the cities are seeing continued growth in infection rate. I put up two links and quotes because I find them slightly contradictory, and I'd like to make some further comments, but let me put another nickel on the meter here. Wait one. Okay, hopefully basically everything's reset. In brief, the Australians have made the point in contact tracing that by the time contact tracers reach an infected person within 30 hours of a positive test, the contacts have already passed the virus down several chains of transmission because the Delta virus is so much more communicable. Now, in the New York Times, an ophthalmologist and public health person at the Harvard School of Public Health advocates for a particular sort of contact tracing associated with recognition of clusters, cluster tracing. I've had a little bit of epidemiology training, and of course hung around with a lot of public health people over the years because that's what emergency medical services does. But I'm no public health expert, and to me, I find these two pieces somewhat contradictory, and that's why I put them up here, curious for others' opinion. This is Steve in Philadelphia, K3FZT, back to men.
Thank you, Steve. Thank you for the description, and thank you for the links that you provided on the instant message feature of NetLocker. And once again, for your continued presence every week. Thank you very much, Steve. Next on the list is KC6, UQT. Greg, go ahead. Okay, nothing heard from Craig. But, yeah, it's late in the roundtable, so a lot of us step away for a minute or have other reasons or places they need to go. W1JOP, would you like to be involved, John, in the roundtable? If so, go ahead.
Yeah, I'll make this my only time to I wasn't there in the morning. I got some stuff to do around the house, but I will listen to the that. I'll only participate this once. I haven't been on this net before, and this is actually the first time I've been on the Quad Net Array in about a year. I used to live in Groton, Connecticut. Moved up to Norwich, and never really got around to setting up my equipment. And myself and the roommates have decided to renew our lease here in December. So because of that, I decided to set everything up. It's a semi-permanent setup. I cannot, it's a rental house, so I cannot set up any antennas in the attic or on the roof. So, RF-wise, I will be limited to a couple analog repeaters, which are very active, and unlimited D-Star with use of the open spot and various other pieces of hardware. So, for what it is, I'm not doing too bad. So anyway, I sent this back to them. Like I said, I'll listen, and if I jump in, I'll jump in. This is W1JP, Big Tap.
Okay, thank you very much, John. Nice having you here with us. I hope you avoided the hurricane last week. You mentioned Groton, but I'm not sure where you're at now, but the hurricanes. Last week was to New England has been amplified here for New Orleans this weekend. And Chip is here with us, M5 RTF from New Orleans. And we're going to finish up the net here soon and let them get ready in preparation for the hurricane. So are there any other stations that would like to do a late check-in to the Medical Arterial Council Digital Voice Net? Go ahead and direct your call to Net Control AA for us all at this time.
No.
And now go ahead and take the mic, Harry.
Before I start, did you copy any of what I transmitted? I went through my whole spiel.
I did copy some of it, but I can't remember, Howard, exactly where you work. We've been having conversations here today. If you want to summarize, again, what's going on, go ahead.
Okay, this is in the Chicago metropolitan area. The city of Chicago, the county, and the state have increased mandatory mask or rolled in the mandatory mask requirements, and several institutions and governments have instituted employee vaccination requirements. Somehow seems to be expected in the Chicago way. The unions immediately raised objections. We'll see how that plays out. Lurie Children's Hospital, the old Children's Memorial Hospital, in the last 30 days reported a 10-fold increase of children being treated for COVID, 29 to 290. And apparently there's similar numbers in other hospitals, which is causing concern as to where they would divert patients to if they get capacity. There are some hospitals where, there's about 20% remaining. So it could get kind of ugly kind of fast, right? Otherwise, my only question would be with the New Orleans area, or I guess Desire. I sure hope they can get by with the shelter in place. That leaves everybody compartmentalized. I know mass sheltering, even if you do try and segregate patients, it's going to be tough. There's no compartmentalization or very limited, and lack of forced air handling due to power constraints most of the time. It gets pretty ugly, and if you get even more dire if there's a hospital or nursing home capacity physically. So I wish them the very best. And my last thought would be, I sure hope we can figure out how to get those guys out of Afghanistan. It's a lot easier if we have the team our back. Leaving the way they are, they're going to be pretty defenseless at the tail end. So those were my only comments. I hope everybody's well, and I'm sorry, I don't know why I'm able to talk even the time prior to the net, and it seems to run into trouble during the net. So it's what it is. 1910, 33 to everyone, I'll be here.
Okay, Howard, thank you. I recognize the statistics there. So yes, you did make it through the first time. So we appreciate that. Do have a question now from your conversation to Chip if you're monitoring in 5 RTF. Chip, with an expected storm surge of 10 feet, in certain areas perhaps even as many as 15 feet, doesn't that have a good percentage of the population absolutely requiring that they cannot shelter in place? And 5 RTF AA 4000.
AA4 in the group N5 RTF. Well, there's two different populations. There's population inside the flood protection levees, which are protected up, in some cases, up to 20 feet. Then there are people outside of the levees, and those are subject to the raw storm surge. So you're looking at height above sea level and distance from the coast as your protective factors. Obviously, a fast-moving storm has less risk of surge than a slow-moving storm. Ironically, the rainfall problem is greater inside of the levees because then you have to pump it out. Outside, it drains easily back into the swamp as soon as the storm is over in 5 RTF.
Well, thank you for the description. One other question or comment. The areas outside the levee system, particularly the rural areas south of New Orleans, are those areas that don't have the same amount of vaccinated protection? Over.
New Orleans actually has better vaccination protection than the rest of the state. Some of the rural areas are very, very reluctant to trust the government and get vaccines. But in New Orleans, almost everybody now knows, knew someone personally who died from COVID. And I see even some hardcore no-vaxxers in the last week or so that have changed their mind and gone ahead and gotten their first shot in 5 RTF.
Thank you, Chip. As I was saying, the intent was more for the outside of New Orleans, like Lake Charles and other areas, Lafayette, other areas that may be subject to that 11 to 15 foot surge. So if those areas are not as vaccinated and they're required to leave and not shelter in place, I would assume that sets up the potential for another wave of COVID, although you're in the middle of the wave now. What are your thoughts on that matter, Chip, and RTF, AA4SL?
For fans of the classics who've read the Odyssey, you remember there was Scylla and Charybdis, and Charybdis was a whirlpool, and Scylla was a six-headed monster. And if you went too close to either of them, you got killed. So you had to sail exactly down the middle, and you didn't really know where that was until you had made it through safely. So the same thing. You've got a hurricane on one side and a deadly virus on the other. So it's a pretty bad year. I don't think I want to go through this again in 5 RTF.
Thank you for the explanation in mythical Greek terms. I guess tide will also play a factor if it comes in high tide. I think it can be horrific. Our best thoughts for you and prayers for you and all the residents of coastal Louisiana, and even those that are going to get floods further along the way in the mountainous areas of the southeast as the storm moves inland in the threat of water and river flooding, which is omnipresent with these storms. Thank you for participating today, especially in light of the preparation. Are there any other comments before we call the net to a close? Director, call to AA4 policy to be acknowledged.
N3IM.
I'm proceeding, Keith, N3IM.
Yeah, just one comment about New Orleans, being that it's shaped like a soup bowl, with most of the city being lower than sea level. It's understandable that the concern for the hurricane coming in, plus the bayou areas are surrounding in the southern areas beyond New Orleans, that there'd be a concern there. This is N3IM back to the DBNet.
N3IM, AA4FL. Yes, thank you, Keith, for pointing that out. As Chip said, the levee system for the people in New Orleans usually works, but I don't know if you're going to Category 5, anything can handle that. But the areas of Louisiana, I guess it's not just about people, it's also environmental because I thought a lot of the land that exists along the coast and the protected can be destroyed by bigger storms. Is that correct, Chip and Suffers? Yes.
I think the best way to look at New Orleans is to take a step back, drop your preconceptions, and draw a line from Houston to Mobile. That what you see is that the north shore of Lake Pontchartrain is actually the southern coast of the United States. New Orleans is basically a barrier island which got silted in on one side, and the rest of it is basically a sandbar island, which has been built on and levees built up to protect it from both the river and the ocean. From an engineering standpoint, it's a stupid place to put a city. On the other hand, I wouldn't want to live anywhere else. N5 RTF.
Thank you for the explanation, and Chip. And again, we wish you the best, and that this not be a direct hit, and that it not go through that potential rapid intensification that could take it up to Category 5 at the time it hits, and hopefully not even Category 4 in the populated areas. And if it's got to come in as a 4, let it come in the less populated areas. But I guess it's deceiving to say that because it's the water that's the potential problem, not necessarily the wind, although it's all a potential problem. Just speaking as a Floridian who's native and been through a lot of hurricanes, but we pale in comparison to the Louisiana area because of the topography of the area. Thank you for everybody that's joined us today for the Marco Hemmings Radio Digital Voice Net. Glad to get a little break from the COVID discussion and get into some other discussions. It is not a COVID net, but we tend to talk about it because it is a net for the Medical Alliance Radio Council that's predominant in the social strata right now, and a medical intrusion to the health and welfare of the population. So thank you for bearing with us as we continue that line of discussion. Until next week, we'll be back at 1500 hours next Saturday as well. I'm going to call the net to a close, return it to the Quantet Array, who graciously offers their technology for us to avoid this communication snafu of different modalities in digital communications. 73 is AA4 Sound bringing the Marco Hemmings Radio Digital Voice Net to a close.
AA4 FLWA when you exit.
Yes, Mark. I'm going to hang around for a couple of minutes. But, go ahead.
I don't know if Chip's still listening, but I can give you an idea of what we were planning on doing over here. I am part of Aries, so we do work with the Red Cross. The Red Cross was ready to set up 4 or 5 shelters. They were going to ask for some vaccination proof, and but if those people did not have vaccination proof, they were going to go the same route as far as trying to quarantine them into a separate area. Everybody in the shelters would have had to wear masks all the time, no matter vaccinated or not. And we had the same problem as far as originally they were looking at a 5 to 8 inch, 5 to 8 foot wave here, and in our area it's low. Also, we have a lot of low areas, and we would have had. They were going to have mandatory evacuation, so that was how we were going to handle it. And I hope, wish you guys down there in on the Gulf Coast, New Orleans, in the area, a lot of luck. So it's WA when you XA.
And I don't know. Yes, Howard, I'm still here. Go ahead. I understand the net control function's really over, but it seems like the right way to do things anyways. I was wondering what their thoughts were. Ladies and gentlemen, New Orleans alone, he's got enough work to do. But then I forget to call sign of the man in book, though, because I have no memory. Um, the system sounds good for the quarantine, but how do you deal with the fact that families wind up broken up and you conceivably then would have like unattended minors or families being forced to go into two separate areas? It's one of those things that sounds good on a tabletop. What were your thoughts about how well that might work in the real world? Over. WA1EXA. So Mark, I guess that is a good question since families have children that aren't vaccinated. So what was the consideration of that?
The discussion with the Red Cross, what they knew that would be a problem because younger children are not vaccinated, and that is why they were mandating the masks whether they're vaccinated or not. But they were going to keep the families together. And, they were not going to split up families if the children weren't vaccinated. They would still stay with the families. And basically, we knew it was going to be some kind of reaction later on, and that we would have a peak, and we were going to have to deal with it. We're not in the middle of a very large outbreak here, so the feeling was that, well, it would peak later. The medical facilities would have been able to handle it, we hope, or we would have gotten extra facilities from the state. So basically, we're going to do our best. I think if that has to be summarized, we were going to try to do our best. We knew people had to come in off the beaches. We knew people were going to be displaced, and we just had to do what we could do. And beyond that, we had to live with it. One thing with Cape Cod is as soon as the winds reach a certain point, our bridges are all closed, so we're basically an island. We get no assistance from the rest of the state once they close the bridges, and people cannot leave either. So if they didn't leave early, they're stuck here, and we have to deal with tourists also. And that same reasoning goes on there. So that was our plan, be it as it may.
Mark, thank you for your response to Howard. Guys, I'm gonna bow out here, and I'll see you guys next week. I'll be anxiously following the hurricane situation. I've been to Chip's house, Chip's and Jerry's house. I know the layout of the one in the corner. They recently just purchased a property closer to the water. So I'll be anxiously praying for them and paying attention to what's going on there. 7-3 all. I'm gonna sign off here and get back to the dissertation review I was working on. Putting the philosophy of music hat on as I work with my son in the Socratic methods. You know, somebody to bounce his ideas and designs off. Have a great week, guys. AA4FL73 clear.
UA1EXA. Okay, 73, Jay. Howard, did I answer your question? Nothing heard. Okay, this is WA1EXA. It'll be clear.
73 everybody. Hope to meet you, many of you from this night in the CVA contest. 73s. See you next week. DY2 BBQ. Off and clear. Bye bye.
73, and we'll see you later. WA when the XA.